This is the village that you need. You need people who truly understand not just what you're going through, but the why behind it and the how to heal it.
There you go, pick your legs up.
It's been a game changer for our family. I don't know where we'd be right now without the resources and support of this clinic.
The adoption clinic was originally founded about 20 years ago, a little over 20 years ago, at UAVN Children's.
The reason why we've moved to start our own freestanding nonprofit is to better serve these children.
Okay, let's try this one.
We are more isolated and it's more private, which is very helpful when you're dealing with a traumatized child. It doesn't feel as clinical as being in a hospital setting, for example. So it's a little bit more peaceful. We've created some living room space so that the family can spread out and feel at home.
It's very trauma informed, from the location of the building to the surroundings of the building, to the layout, the colors, the staff that we've chosen. Now we have a space that is just specifically designed with our children in mind.
The experience and the history of the staff is rather unique.
A lot of our staff are stakeholders in adoption, meaning that somewhere in the adoption constellation we have a personal connection.
On staff, we have 2 adoptive parents that are part of our team, and then we have 2 adoptees, myself as an international adoptee, and then we have a domestic adoptee as well. So we've lived it.
So we get the report card. They just have so much knowledge and perspective that other professionals don't have.
One of the most important things you can do for your adoption is to prepare and to educate and to build a team.
It's so much easier to take care of problems as they arise, rather than once they become a crisis level.
And the earlier that you address these issues, the better it's going to be for the healing of your child.
Adoptees and kids in foster care have such unique needs. Their development is shaped by what they've been through, and a mainstream pediatrician or therapist is not going to have the specific training that is geared to look for the needs that are particularly present in this population.
Our clinic is really unique because we work as an interdisciplinary team. So we really strive for every person who comes through the door to see all specialists, because again, our kids are super complex. And so we need that medical component and that physical component. We need the developmental component, and we need the mental and emotional health component.
So each person will evaluate the child, then we come together and do an interdisciplinary conference to decide where are we going to start first? Like, what are the issues and where do we start first in helping your family get back on track?
This team of people are the most well-equipped, educated, trained, experienced, knowledgeable group of professionals that we've ever worked with.
I would like parents to know, if they're at home struggling with their child, that there's hope and they don't have to be alone.
We brought home a very overwhelmed, traumatized little girl. But after almost 8 years of support from these therapists, she is thriving.
Once you are a patient of our clinic, you are always a patient of our clinic. And this new building is a community, it's a family. That's why we have a living room instead of a waiting room, because we want our families to be reminded that they are welcome here anytime and that this is a new home for them.